Hello and welcome back to my channel. For those of you who are new to my channel, my name is Christina and I am a recent breast cancer survivor and decided to start this YouTube channel to just help educate and to help encourage people along their journey. Today's video is a little bit different. I am also a dental hygienist here registered in Washington State, and I wanted to talk a little bit about the oral implications along your chemo journey. One of those big implications is dry mouth or xerostomia. And so I wanted to just make this an overall video so that people who are experiencing dry mouth or xerostomia outside of chemo, just from one of their regular medications, can find some tips and tricks to help them along their way. I also wanted to put this video specifically up on YouTube today because today's April 1st. And it is the beginning of Oral Cancer Awareness Month, which is something that is really important to me and those in my field. So I wanted to start by just encouraging you to visit your dental professional and get your oral cancer screening. So one of the reasons why dry mouth can cause such havoc in the mouth is because it's creating a really acidic environment. The saliva isn't offering that buffer to help raise the pH, which when you have an acidic oral environment, it can help cause tooth decay, and it can also help you not be able to swallow well or be able to chew food well, which is just really annoying. And for those of you who are experiencing that, know that it's just really uncomfortable. One of the best things that I can tell you is sipping water throughout the day. Just frequent sips of water helps to raise that pH. It helps to wash the oral cavity out and just helps with that overall comfort of the mouth. But one of the things that I did use when I was going through chemo was a dry mouth gel by Sciences. This is just glycerin. So all this will do is to help moisturize the cavity. You just drop a little bit on the tongue and then rub it around the mouth, and it helps to lubricate the mouth, which is really great. Another one, which I didn't really like when I was going through chemo, I don't know, it didn't feel quite right to me, but it is also glycerin, but it also has xylitol in it, which I'll talk to you more about here in a second. But this does help moisturize the oral cavity, and this is readily available. You can get this Rite Aid, Walgreens, Walmart, wherever. Another product I wanted to talk to you about was a product by Oracoat, who I had written letting them know that I was about to record this video, asking for some samples of another product that I'll get to in a little bit. And they sent me this product, which is called Zoila Gel, and I got really excited about it, and I really wished that I would have been able to use this during my journey. I tried it, I tasted it, and I just put a little bit on my tongue, just like the other one, and you swipe it around the mouth, and it just has this really lightly sweet taste, and it doesn't feel like a glycerin, like a Vaseline in your mouth. It just really helps to lubricate the mouth and feels really great. And what is great about it is that it has 17% xylitol. Now, xylitol is a natural sweetener. And in the dental hygiene world, or the dental world, I should say, this product is something that we all rave about. The FDA has not recognized xylitol as something that helps to prevent tooth decay. However, many studies show that it does not help promote tooth decay. And the reason why is because it's raising the pH of your mouth and helping that environment to be less acidic. But it also helps to kill off a lot of the bacteria because they can't metabolize xylitol. So it's a really great product to use during dry mouth, during any time really when your mouth is experiencing acidity, like after eating a meal or something like that. Speaking of xylitol, I wanted to talk to you a little bit about some xylitol products that I also enjoy, not only during my chemo journey, but just in general. I will always have one of these tins in my purse, in my car, everywhere I go because I use it quite frequently. Now, you don't want to use too much xylitol throughout your diet throughout the day because it can cause some digestive issues. But if you're just using it, after every meal or lightly throughout the day, then you shouldn't have any problem. But this product is ice chips. It's sweetened with xylitol. They have a wide array of candies that you can try. I just have peppermint and lemon here, but I'm They probably have it in 20 different flavors, which all taste really good. I've tried quite a few of them, root beer, margarita. But one of the things that will help with is just help promote that saliva flow and to raise that pH and just make the oral cavity a lot more comfortable. Another product that I wanted to talk to you about is another xylitol product. This doesn't have as much xylitol in it as the other products that I showed you between the ice chips and the Zoila Gel, but it does have xylitol in it. And this is what it looks like. It's just a small little lozenge, a dry mouth lozenge. Now, I experienced burning mouth when I was going through chemo, and so sometimes these products, it had a really pepperminty taste to it, and it caused me some discomfort, and so I didn't always use these. I stuck with the ice chips, and I really like those. Or my next product that I wanted to talk to you about, and this is the product that I had written Oracoat about, and that's their Xyla Melts. It's a little tab that you stick on your gum tissue that just releases xylitol over a period of time. I've had one in, you can kind of see it back here, throughout this whole time. And that's the greatest thing about it is you can stick it right on your gums. People don't even know it's there. I sometimes put one in and then throw my mask on at work. Nobody would even know that it existed. They do have a mild mint and then a mint free. I personally like the mint flavor because it's a really light mint flavor. It's not something that caused me any trouble. However, if you're somebody who's experiencing severe burning mouth or mouth sores, this might help you along your journey. I suggest this product to more dry mouth and chemo patients more than anything else, just because I really like how it does have that lasting effect. You can get these at CVS, Rite Aid, and Amazon. I've actually never seen them at CVS or Rite Aid, but I have ordered them off of Amazon, and you can buy a large pack of them. I would say they can say they last up to 2 hours, but I would say they last in my mouth about 40-45 minutes or so. Another product that is something that a lot of people use or suggest for dry mouth is the Biotene Mouthwash. It's actually a moisturizing oral rinse. This is something that I did not like when I was going through chemo. I just felt like it had left a really yucky flavor in my mouth. And then I started reading it, and I saw that it has a low pH, which I thought that kind of counteracts what we're trying to do here. So by using this in an already low acidity environment, you're adding something else that has a low acidity to it. And so I just felt like this was something that I wanted to talk about to veer you away from using, especially when you're experiencing dry mouth or going through chemo. I just really feel like this would cause some tooth decay overall. Now, if there's anything I could suggest the most when you're experiencing dry mouth, that is frequent sips of water throughout the day. Even if you're somebody who's just watching this video and you don't experience dry mouth, you're not going through chemo, frequent sips of water throughout the day, swishing with water after a meal or after drinking something acidic is just really crucial to helping clear that oral cavity and to help you not have an acidic environment. Another product I wanted to talk about was Fluoride Toothpaste, and this is a prescription fluoride toothpaste, and you can see it's very well used. I think I have about 2 drops left of it. This is something that when somebody's getting ready to go through chemo, I encourage them to use. This is a great product also, and it's something that you would use lastly before bed. You get ready for bed, you floss your teeth, and you brush with this and make sure it's the last thing that you do. You don't want to eat or drink anything after using this. You want it to sit on your teeth all night long and just to help strengthen that enamel. And another fluoride product that I wanted to talk about was Act Fluoride Mouthwash, or just any fluoride mouthwash. This I would suggest using morning and night. Now, they do have mouthwashes that can have alcohol in them, and if you're somebody who's going through chemo, burning mouth, or dry mouth, you definitely do not want to get anything with alcohol in it. Make sure that it says alcohol free and that it has sodium fluoride in it. Other than that, it doesn't matter what brand you get. I just really like the flavor of the Act mouthwash, so that's why I choose this one. So that pretty much covers everything about dry mouth as the side effect from chemo. So if you're somebody just stopping by for the dry mouth portion of this, you could probably turn it off right now. But I want to talk to you about some other side effects of chemo. One of those side effects is mouth sores. And one of the products I wanted to talk to you about was also from Oracoat. They do have these HB12 melts. It's a similar type of disc that you put in your mouth, just like the Zoila melts. You don't put it on the sore, but you put it near the sore so that it can help to promote that healing process, and it also helps to relieve pain. This is another really great product to have. Another side effect is mucositis, and that can affect your mouth, your digestive tract, and even all the way up to your nose, which is something that I definitely experienced. So I'm sorry if you're going through that, because I know how painful and uncomfortable it is. It was probably the most annoying thing that I dealt with throughout my journey. Now, unfortunately, there's no cure. It's just kind of bearing with the symptoms as you go along. One of the things I can suggest is to eat no spicy food and make sure that everything that you try, like the mouthwash I was talking about, is alcohol-free. You don't want anything that could help to burn your mouth any more than it already is burning. Another thing is to suck on ice chips throughout the day, or just drink frequent sips of water. Now, the ice chips, I did want to say that I only want you to suck on them and not chew on them, because chewing on them can cause damage to tooth structure if you do it too frequently. One of the side effects that I did want to talk about was vomiting, which unfortunately I did experience, so I'm sorry if you're going through that. So vomiting is going to introduce gastric acid into the oral cavity, which can eventually lead to tooth erosion, tooth decay, and to hot and cold sensitivity, which I really want to help you avoid at all costs. Now, one of the things that I hear about all the time is when somebody vomits, they want to go brush their teeth. And if there's anything I can tell you, it is to not do that. Now, it seems like it would help, but it actually causes too much abrasion on the tooth enamel. So if you are somebody who's vomiting throughout the day, if it's one time, I would give yourself a good 20 minutes and then go through and brush your teeth. But if it's something where you're vomiting frequently throughout the day, swishing with water can help with that, or mixing some water and baking soda can help with that also. It just helps to raise the pH of the mouth so that you're not having a really acidic oral environment. Because it is affecting your enamel of your tooth, one of the things that you might want to use is that Fluoride Mouthwash or that Fluoride Toothpaste that I was talking about. And that will just give you that opportunity to help strengthen that enamel so that it doesn't deteriorate over this short time that you're dealing with this. Another thing that I did want to talk to you about was when you have really low white blood cells, make sure that you're not going to the dentist when you're getting your teeth cleaned. When we go and clean under the gums, we're introducing this bacteria back into your oral cavity, which can cause problems. So just try to avoid the dentist if your white blood cell counts are extremely low. I would also like to encourage you, when you're going through chemo and radiation, to just maintain excellent oral health, and that means brushing at least twice a day. I would prefer it after every meal, and make sure that you do floss. It will help you to maintain good oral health throughout your journey. And if you're somebody who's getting ready to start chemo, make sure you make an appointment with your dental hygienist. Getting some hygiene treatment before you start your chemotherapy is really important. Also, when you go in for that appointment, talk to your dentist about getting some fluoride trays. That's one thing I haven't discussed yet. You can have fluoride trays that are made and that you put a fluoride gel in them, and then you just put them on at night, and it just helps to really strengthen those teeth. Okay, I think that's pretty much everything that I wanted to say. I really hope that you learned something, and this really helps you along your journey. And as always, I would love to encourage you to hit that subscribe button down below. I am trying to create a lot of videos that could help you along your journey. And if you did like this video, give it a thumbs up, and please share it with your friends or anybody that you know might be experiencing either dry mouth or getting ready to start chemo. And thank you so much for stopping by. I hope you have a great day. Bye-bye. I wanted to talk a little bit about the advantages. One of the things I already touched on, and that was a lot less IV pokes or needle sticks as they would call them. I felt that that was a huge benefit on my part.